There's a lot to unpack on this issue. Dr. Joseph Meaney, president of the National Catholic Bioethics Center, joins us now to discuss. Dr. Meaney, the series of medical pills that provokes an abortion, as Mark described in his package, has been available in the U.S. since 2000. How has this changed the abortion debate over time?
Well, one of the things that it has done is changed how abortion is done in America. Increasingly, the majority of abortions are being done through these pills as opposed to surgery. And that opens up a huge Pandora's box of all kinds of ethical and medical problems that are associated with it.
And for doctors specifically, how has the abortion pill created new ethical concerns?
Well, one of the things is that, doctors perform procedures and they have a certain expertise and professionalism, et cetera. They're board certified, all these types of things. When it comes to the abortion pill, this is essentially self-medication. So people are taking it at home without medical supervision. Telemedicine is kind of the way it's being sold, but actually people are having their abortions at home and, being rushed to the hospital in some circumstances, et cetera. It's a completely different experience of abortion than the surgical abortions.
And in terms of informed consent, the idea that people are actually aware of what they're doing.
Correct. Yeah. So one of the things that is the basis of medical ethics is that you have to understand a procedure. You have to understand the risks and the benefits and make an informed choice. And what happens with abortion is that people don't make an informed choice. Those abortion providers generally do not provide. And that's why actually states have passed so many laws requiring ultrasounds, requiring, information to be given about other options, all these other things. But it kind of goes to the new level when you have these abortion pills, because some individuals, skip the doctor 100% and they just get the abortion pill and take it. And they don't have any idea of the dangers and the risks and all the possible things that can go wrong. So it raises major ethical concerns.
Well, let's talk about those other options. Abortion pill reversal methods, ways to interrupt the abortion process, are also being considered as important in part of this waiting period. Some states are trying to legislate that to give mothers a chance to change their minds. This began about a decade ago, right? Is this widely used and effective?
So it is used and effective. It's actually been heavily attacked by the abortion industry and abortion supporters, but the science of it seems very good, that if taken early enough, one can reverse the effects, because essentially what the abortion pill does is detaches the child from nutrients. And so if you can reverse those hormonal effects, then the pregnancy can go forward. But many abortion advocates do not want that information to be available. And it does create another ethical situation, right? The woman has made the choice to have an abortion, taken the pill, and then all of a sudden she, reconsiders and wants to change her mind. A lot of the abortion side would say, no, it's too late. You can't change your mind anymore. You don't have any more choice. The pro-lifers are saying you still have a choice. There's still medical options for you to reverse that abortion. And of course, ethically, one should be offering people good moral choices.
We have all kinds of heroic methods to save a life outside of the womb. Why wouldn't we have heroic methods within the womb, right? Is that part of the framing for it, this idea that you have to have other options at all moments?
I think so. I mean, we're obviously free. As human beings, we have free will. We can make bad decisions and good ones. But the point is, we should have informed consent, and we should have as many options as possible that are good options. Now, if something is a really bad option, such as having an abortion, it's actually good for the law to prohibit that. And I think that the abortion pills should be illegal in any state that has no legal surgical abortions. An abortion is an abortion, whether it's a surgery or a pill.
And the language about abortions matters here. The Washington Post and others have complained about the term pro-life, but this matters even more so in the context of medical associations and just the medical practice. How has language around life changed for doctors or been threatened to change when it comes to abortion?
Yeah, I mean, one of the things that I find most terrible is, the side that backs abortion calls itself pro-choice. The side that backs life calls itself pro-life. But then, there are all these different ways that gets permutated, right? So they refer to pro-lifers as anti-choice, those who are favoring abortion, as pro-abortion, et cetera. In the medical profession, frequently they don't even use the term abortion. They say termination of pregnancy. Now, technically speaking, a delivery is a termination of pregnancy, right? The pregnancy ends. but there's no moral fault there. Whereas when you're intentionally killing a child through a procured abortion, you are killing. And that goes against medical ethics in the traditional sense of Hippocratic medicine, which mentions abortion specifically. So, I mean, the rhetoric has changed a lot over time, but I think the emphasis on choice and just saying that one is pro-choice is insufficient. You have to say pro-choice about what? What are the choices that you're in favor of?
Well, let's talk about some of those choices, just because there's such a variety of exceptions in some of these laws. It can be overwhelming for Catholics. How should they evaluate considerations like rape and the life of the mother, especially around this medical abortion debate?
Yeah, so I mean, the one consideration where Catholics have, a real education that needs to be done is when it comes to the life of the mother. So you can never do a direct abortion, right? We can never kill someone to save another person. However, using the principle of double effect, one can justify treatments to save one patient that could have a deleterious effect on another patient. And both are patients, the mother and the child. But in some circumstances, it's impossible to save either the mother or the child. In some circumstances, it's impossible to save the life of the child. And one has to do everything one can do to save both, right? But so the key point is that abortion is never necessary. A direct abortion is never necessary to save the life of the mother. What could be necessary is a procedure, to treat her cancer, even maybe a hysterectomy, something of that nature, that would directly attack, what is the problem, the health problem, and the unintended but foreseen consequences. The child might die from that, but that is different from a direct abortion. The Church has made a strong distinction there.
Do you think that this moment we're living right now is an opportunity for the Catholic Church?
Absolutely. I mean, the Church has been standing for life so strongly, right, since Roe v. Wade. And now that is coming to fruition, right? Society is moving in our direction. And I think the Church should be congratulated. The Church is certainly being attacked for having stood up so valiantly for life. But this culture of life that St. John Paul II spoke about is really coming to bloom in the United States. And that's a beautiful thing to see. And it can't stop. It has to continue, go beyond abortion to so many other issues that are life issues.
Well, Dr. Meaney, you've given us a lot of food for thought, both in how we need to inform ourselves, the way that we can manage these considerations, and how to be hopeful for the future. Thank you so much for joining us.
Oh, thank you.